Ashley asked me if I'd write her a song, so I wrote her a song for her awesome show. Her show is cool and it's lots of fun, so get your popcorn ready, everyone. Who will she interview on her show today? The Jonas Brothers or Nick Lachey? It's the Awesome Ashley Show. The Awesome Ashley Show. The Awesome Ashley Show. La 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 la.
Hi, welcome to the Awesome Ashley Show. Today we'll be talking about neurologists. I have Dr. Dolan with me. Hi, Dr. Dolan. How are you?
I'm excellent. Thank you, Ashley. How are you?
Good. Thank you for being here today.
Oh, you're welcome. Hopefully we can share some good information today.
What is a neurologist?
A neurologist is someone who has completed medical school, obviously is a doctor, and neurology is the study of the brain, the spinal cord, and the peripheral nervous system, sort of the command and control center that helps you with thought process and moving and just kind of doing all the things that you're used to doing on a day-to-day basis.
So what is your specialty, all three or just one? Or?
I'm a general neurologist, so I see all sorts of different diseases of the nervous system, things like strokes and Parkinson's disease, multiple sclerosis, epilepsy, diseases of the peripheral nerves like carpal tunnel syndrome or neuropathy, pinched nerves, or diseases of the muscle like different muscular dystrophies or myopathies, things along that line. And then I've also done some additional training in special testing of the nerve and muscle.
Wow. How long does it take to train? How long does it take to go to school for your kind of specialty?
Would you believe it if I said as long as you go to grade school and high school?
No.
But it does. So after you finish grade school and high school, so that's 13 years, right? Mm-hmm. You have to do 4 years of undergraduate degree to get your bachelor's. Then you have to do 4 years of medical school and then 4 years of residency.
Is there a reason why you picked neurologist?
I did. When I was in medical school out at University of New England just up the road, I really enjoyed the nervous system. It's not too different from an electrical system, and it just sort of made sense. So,
do you deal with a lot of people that have strokes?
Deal with a lot of strokes, absolutely. And as our population gets older, we're going to see more and more of that. You know, getting old and having birthdays is the biggest risk for stroke that there is.
Because actually one of my family members have strokes, and I get really nervous when you see someone that has a seizure. Like, what do you do? What's the recommending thing? What do you do when you see someone have a stroke? Do you wait like a couple minutes before you call 911, or how does that work?
So if you see someone who's had a stroke, then generally what you'll see and what they may tell you is going on is they'll have some sort of symptom that is on one side of the body or the other. So they may have numbness or tingling or weakness on one side of the body or the other for a stroke. A lot of times you'll see someone with a droopy mouth, or maybe they're slurring their words like they've spent too much time at the local tavern and they have some slurred speech. Sometimes people with stroke will lose vision in one eye, like they had a shade pulled down over their eye, or maybe they have double vision or very bad dizziness or very bad incoordination. As soon as someone complains of those types of symptoms to you, then you're going to want to try and get them either to get them to call their regular doctor, their primary care doctor, or get them to the emergency room right away. The earlier they get to the emergency room, the more options we have open to us to provide them treatment for the stroke. There are certain medicines that we can use to try and take the severity of the stroke or how bad it's going to be and minimize it, but there's only a certain amount of time that those medicines can be given in. And if you don't act within that window of time, then you never get the opportunity to act.
Now, why does foam, because when my uncle has seizures, like foam comes out of his mouth. Why does foam come out of your mouth?
Okay, so strokes and seizures are two different things. So when you have a stroke, either the blood flow is interrupted to a certain region of the brain because there's been a clot that's formed. Sometimes that clot forms by platelets, which are the body's equivalent of the little boy who stuck his finger in the dike, right? You got a hole in the dike, and you jam up that hole so that you don't leak fluid, okay? And platelets do that, but if they do that in a small blood vessel, then the pipe gets clogged really quickly, and then that tissue that's downstream from that pipe doesn't get the blood flow and the oxygen that it needs to stay alive. Sometimes that same sort of clot can come from your heart and get flipped up into your brain. Every time your heart pumps, 1/5, 20% of the volume of blood that's squeezed out of your heart goes right up to your brain.
Oh, really?
So that's an awful lot of blood flow for a relatively small area of your body, right? Sometimes you can have a stroke where you actually have bleeding into your brain, which is a little different from the other two types. In a seizure, what happens is your brain begins to discharge in a fashion that is far too rhythmic, okay? And by that I mean that if you took your brain and you hooked it up to speaker wires, okay, and we listened to it, your brain would sound like Jiffy Pop. You know what Jiffy Pop is, right?
Yeah.
Or microwave popcorn for the younger people who may be watching this. Old guys like me know what Jiffy Pop is. So if we listened to your brain on tape, right, we hooked you up to speaker wires, you would sound like Jiffy Pop or microwave popcorn. So the front part of your brain has a certain frequency or firing pattern. The sides of your brain have a certain firing pattern. The top of your brain, the back of your brain, and it's all different firing patterns. So when you put all those firing patterns together, you don't wind up with a very synchronous sound. So it's like a mashup tape, okay? So you have an NSYNC song playing, and you've got a New Kids on the Block song playing, and you've got a Snoop Dogg song playing, and as you listen to it, it just doesn't make sense, right?
Yep.
But that disorganization, if you will, is how the brain is supposed to be organized. And different regions of the brain have different frequencies of firing pattern, okay? And that's normal for them. In a seizure, what happens is one particular region of the brain, and it depends on what seizure type you're having, but one particular region of the brain begins to exert its will over the other neighboring regions of the brain, and you go from Jiffy Pop to Beethoven's symphony, and you wind up with your brain firing in a very synchronized, very rhythmic fashion, and that produces a seizure from an electrical standpoint, okay? So if we're watching your brain discharge electrically, that's what we're going to see. Now, when we watch you, not you personally, but you meaning the patient who's having a seizure, that's not what we see. We don't see the electric waves. We don't see what we call an electroencephalogram, or the brain waves, flashing across your eyes like on a computer screen. Instead, we will see, by and large, people having unusual movements, okay? And there's lots of different seizure types.
That's my next question. What kind of different types of seizures can people have?
Okay, so when we look at seizures, if we look at the two big kinds, we look at generalized seizures and we look at partial seizures, okay? Generalized seizures are seizures that we'll usually see in kids, meaning that they are representative of what happens in the pediatric population. And in a generalized seizure, the entire brain will begin to discharge in an abnormal and excessively rhythmic pattern all at once, just like that, okay? Those are generalized seizures. And the generalized seizures include tonic seizures, where the body gets very, very stiff. Clonic seizures, where there's rhythmic activity, herky-jerky motions. Myoclonic seizures, where there's just kind of a big sort of snap and big singular large amplitude, so big motor movement. You ever watch Michael Jackson dance? Sometimes he'd snap his finger and throw his arm out like that. That's sort of a myoclonic movement, where there's a big, sort of very localized movement of arm or leg. You can have atonic seizures, where the body just kind of loses its tone and you drop to the ground. Or you can have tonic-clonic seizures, where you have tonic activity, stiffness, followed by rhythmic activity. So those are the generalized seizures. Then you have your partial seizures, which imply that a small region of the brain is responsible for that discharge, and that region of the brain goes into this abnormal rhythmic activity, and you'll see the expression of that outwardly based on the region of the brain that's affected. So your brain is organized very specifically, and there's a certain region of the brain that controls your arm, a certain region that controls your leg, a certain region that controls your face, your eye movements, and your brain's crisscrossed, right? So the left side of the brain controls the right side of the body, and vice versa. So if you had a partial seizure that started on the left side of your brain and involved just the region of the brain that controlled your arm, then just your arm would go through herky-jerky movements. And these partial seizures can either affect your level of consciousness, so that's how you interact with your environment, right? Are you awake? Are you talking? Are you laying down memories? If there is no change in your level of consciousness, we call those simple partial seizures. If there is a change in your level of consciousness, we call those complex partial seizures. And just to make things even more confusing, you can go through what's called a march or a Jacksonian march. There's a very famous neurologist, Dr. Jackson. He was a French guy over in France, and he documented what's called the Jacksonian march, where you may have a simple partial seizure, where maybe just your arm's jerking, but you're still talking to somebody. And then you go through a complex partial seizure, where all of a sudden you're not interacting with your environment anymore, maybe staring off into space. And then sometimes that involvement can get so big and so large that you start to involve both sides of the brain, and then you have a generalized seizure on top of that. So you can have secondary generalization to these partial seizures. So there's lots of different seizure types. One last thing, I forgot absence seizures or staring spells. Those are a kind of generalized seizures that you can see, and they're called petit mal or absence seizures, where folks will just, usually kids, will just stare off into space for 10 or 15 seconds and then kind of snap back into it. Different from daydreaming like we all did in grade school, right? Especially on nice days when we wanted to go out and play in the sun like today.
Now what happens with my uncle when he wakes up, he goes, that was a fast dream, and he goes, I don't remember the dream. So like when he wakes up, he's like, I had a fast dream and it was a really cool dream, but I don't remember it. Like, does that usually happen when they wake up, or does it depend on like what kind of seizure it is, or like, because we have no idea what kind of dream he has. Like he goes, it's really fast, and then he just wakes up out of it and he goes, what happens? Because they don't know what happened when they're in the seizure. So like we tried to explain to him and he goes, oh really, that really happened? Like, so, and he falls, and like there's like worse seizures. So what do you do so they won't hurt themselves? Because they can hurt themselves when they have a seizure.
Sure. So the first part of the question being, you know, what's happening to your uncle as this is going on. Different regions of the brain are firing and discharging in a pattern that is unusual and a little bit abnormal. And he's not laying down memories like you and I would be laying down memories when that's going on. So it sounds like he's having what we would call complex partial seizures. So he's staring off into space and may have some funny rhythmic activity, jerking movements in arm or leg.
He's like asleep, like his eyes just shut.
Yeah, so it sounds like he's having a complex partial seizure, and during that time, enough of his brain is involved that he's not able to interact with his environment in a meaningful way. So his level of consciousness has changed a little bit, and he's not going to be able to store memory, so he doesn't recall those events. It's very common after that kind of seizure, a complex partial seizure, or most of the generalized seizures, to have what's called a post-ictal state. Post meaning after, ictal meaning event, state meaning there's a change in your level of consciousness. So these people, you know, folks with seizures or epilepsy will have the seizure, they'll have the event, and then they're a little confused and they're a little cloudy about what happened, and they don't really, they're not really sure where they are. And then we have to explain to them what happened. Exactly. So what do you do when you see someone having a seizure? A lot of it depends on what kind of seizure they're having. The best thing to do is to get out of the way, okay? You never want to try and hold someone down when they're having a seizure. You never want to put anything in their mouth when they're having a seizure, especially your fingers, because when you have those violent contractions or tonic movements of the muscles, you can bite down so hard, the patient having the seizure could bite down so hard they could literally bite your finger off, okay? If you can, try and clear the area so there's nothing for these folks to get injured on. And when they're done the seizure, you want to make sure that they are on their side in what's called the recovery position, so lying on their left side so that they're able to breathe relatively easily. And if they do happen to get sick, meaning have a bout of emesis or throw up, that their airway is going to be protected and clear, okay? If someone has a seizure for more than 5 minutes, then you need to make sure that you call for an ambulance, you dial 911. If someone has a series of seizures, more than one seizure, without coming back to normal, meaning that they clear their postictal state, so they may be a little confused afterwards, but they come back to normal and they're talking to you regularly and they're interacting with you appropriately. If they don't do that and they have another seizure, then you absolutely have to call 911. That's called status epilepticus, and that's a medical emergency. And they need to be brought to the emergency room. They need to be given medicines so that you can break that seizure, because that's a true emergency, and people can die from that. And if they don't die, then there can be irreversible damage done to their brain cells, done to their neurons, and there can be a lot of problems that develop because of that. So anyone who has a seizure for more than 5 minutes, or anyone who has more than one seizure without clearing and coming back to normal in between, those folks need to go to the emergency room immediately, because they need emergency medical care.
Now, what do they do when you bring them to the hospital? Do they give them an EpiPen or something to wake them up, or?
Nope. They give them special medicines to stop the seizures from occurring. A lot of times, people with seizures will be on what are called anti-epileptic or anti-seizure medicines. And what we'll do, if someone does require emergency treatment, is they'll get a special kind of medicine. It's called a benzodiazepine. It's a medicine that helps to suppress the activity of the brain cells and kind of squash that abnormal rhythmic activity. The medicine that we usually give is Ativan. Sometimes they'll give a special form of Valium. They can give that, it's in a jelly, so sometimes they can give that either in your nose or in your rectum if there's an emergency situation. A lot of folks with epilepsy will have that with them at all times, so you can use that. When EMS or the ambulance arrives, they'll start an IV, so they'll put a special catheter, a special straw into their vein, and then you can get the medicine in really fast. And we'll give those medicines until the seizures stop, and then we may or may not have to give them additional seizure medicines, special anti-epileptic medicines, to keep them from having recurrences of these seizures. So there's a lot of things that we can do for those seizures immediately during that emergency situation, and that's something that has to be intervened upon very, very quickly, because the longer people with seizures have active seizure activity, the longer the seizure is going to go on, and the longer the seizure goes on, the harder and harder it is to stop. The good news is it's very rare for that to happen.
Now, what is epilepsy? Because I noticed you mentioned it a few times when you were answering the other questions.
Sure. Epilepsy is the act of, it's a medical diagnosis like diabetes or high blood pressure, and it's the act of having recurrent seizures. Okay, so seizures and epilepsy are related the same way that a chapter in a book or a scene in a movie, a verse in a song, an inning in a ball game are related. You have to have more than one of the first, the seizure, in order to be diagnosed with the second, epilepsy.
And how do you know it's how do you know it's epilepsy and not just a seizure? Like, is there different signs to know it's just epilepsy and not like a seizure?
It's the recurrence. So when you have more than one seizure without a single identifiable cause being found, then those folks would have epilepsy. So sometimes people will get seizures from medicines, right? So if you have an allergy to a certain medicine and you get a seizure, that doesn't mean you have epilepsy. Sometimes people who drink alcohol regularly and then stop drinking the alcohol will have what's called a withdrawal seizure. That doesn't mean they have epilepsy. It means they had a withdrawal seizure from the alcohol. But people with epilepsy will have recurrent seizures, more than one. They generally will have abnormalities on their brain waves, on their EEG, the recording of the brain waves.
And that's a test that people can take.
Yes, that's a test that we'll do when someone has a seizure, and we want to see what kind of seizures they have, because what kind of seizures you have does have an impact on what kind of medicines that you take. So we have lots of different medicines we can use for seizures and epilepsy, but we have to make sure that we're giving you the right kind of medicines, because certain medicines for certain seizures don't work very well, and they can actually make the seizures worse. Exactly. So before we give you a medicine, we want to make sure we give you the right stuff, right? Take the blindfold off before we shoot the arrow at the apple.
That's why
on
you
top
probably
of your
have to
head.
do so many tests. Like, how many tests do you have to do to realize that it's epilepsy and not, like, is there certain tests you do for, like, spines and stuff?
Sure, we do certain tests. The biggest test that we'll do when someone comes in to be seen who has had a seizure it's not a test at all. It's a history and a physical, meaning we'll sit down, not too different than how we're sitting down right now, and we'll talk to you. Tell me the story. What happened? How did it happen? Who witnessed the event? Was there anything unusual? Did you not get enough sleep? Did you go out and take some new medicines, or did you take any street drugs that you probably shouldn't have been taking, or had you been drinking very heavily and then all of a sudden stop? Do you have a history of this happening before, or anyone in the family have a history of this? Then we'll do an exam, make sure that your brain and peripheral nerves are working appropriately. Once we get that information, then we'll probably order an EEG or electroencephalogram, look at your brain waves, and we'll do a couple of different forms of that, right? We'll do a regular one. Sometimes we'll do one when you haven't slept very long. It's called the sleep-deprived EEG, because sleep deprivation makes your brain more irritable, and an irritable brain is more likely to show tendency towards seizure or epilepsy. Sometimes we'll do a prolonged EEG where we put special electrodes on that stay on for 24 hours, have you leave with big bandages on your head, and then we record that brain activity for a whole day.
Is it recording that goes with them, like in their pocket or something?
Yeah, you leave with a little box, like on your belt, like a little fanny pack, right? And you walk around with that for a full day, and we record your brain activity for a full day, because we want to see you in your natural environment and see if we can't pick up some of these abnormal brain waves that would indicate that you're at risk for epilepsy. And then once we determine that, we'll determine whether that single seizure that you had was just a single seizure and it may never happen again, or if it was indicative of a tendency towards epilepsy, in which case we'd want to give you medicine so that we reduce your risk of having another seizure. Because there are lots of bad things that can happen with seizures and epilepsy, right?
Yes.
Imagine what happens if you're driving a car and you have a seizure and you ram into a bus full of kids, or into a crosswalk full of people, or you ram your car into another car or a telephone pole or a tree. We want to make sure that
you never know when it's going to happen. It just goes
you got
like
it.
that.
You never know what's going to happen. Some people are lucky, and they'll have what's called an aura, or a warning before
So
they
they'll know
have
it
it.
happens.
Yeah, they kind of get a warning before it happens. Do you have a dog, right?
Yes.
And do you have an electric fence at the house?
No.
So with an electric fence, your dog will wear a special collar. And as the dog gets closer to that electric fence, that collar will start beeping, right? And the dog knows to stop, because if it keeps going and it goes outside the electric fence, guess what happens to that collar? Kazap, exactly. So the dog hears the beeping and says, uh-oh, time to back off, right? If the dog doesn't listen to it and keeps walking, then zap, zap, right? So that's kind of what an aura is. It's that beeping sound before you have the the electric shock of the fence.
Because one of my friends, she has seizures, but she has a dog, like a
Right.
guide dog,
Sure.
that can tell that they're having a seizure before they can. So she actually gets warned that you're having a seizure. Like, I don't understand how the dog can do that, but it works really well for her. So
They're called epilepsy dogs or seizure dogs, and they can sense after a while, when the dog and the patient have been together, the dog can pick up on and sense that the patient is going to have that seizure, and serves as a good warning for family members or even to the patient themselves that that event is going to happen, and they can get to a safe spot. When they say that an animal can sense fear, well, the animal can sense seizures as well. So it's amazing the difference in the senses that animals have compared to humans sometimes, I'd say.
that's cool.
Yeah, it's very interesting stuff.
So what other things do you do besides seizures? Like, what other is your, like, you talked about dealing with the spine and stuff. Like, what is that part? What do you do with that part?
Sure, we take care of strokes, we take care of epilepsy and seizures, we take care of folks with Parkinson's disease.
What do you do for people with Parkinson's disease?
There's lots of medicines that we use to try and help them function and maintain their day-to-day function. We take care of folks with dementia, like Alzheimer's disease, so that they can stay functional and independent and safe at their home and their environment. Sometimes we'll take care of people who have problems with peripheral nerves, right? So like carpal tunnel, your hand goes numb when you're driving your car, or maybe a pinched nerve in the elbow or pinched nerve in your neck. We'll take care of people who have arthritis in their spine, so there may be compression of their spinal cord as it goes down their back. There's all sorts of different things that we take care of besides seizures and epilepsy and Parkinson's disease and things that have to do with the brain.
How long have you been a neurologist for?
I finished my training in neurology in 2000, so I've been a neurologist for 13 plus years.
What do you do when you're not in the office?
When I'm not in the office, I like to hang out with my family, my wife and my kids. I coach the girls soccer team.
I was just going to mention that, because when I called a couple times, because they always told me you call around like 12:30, and when I called one time, they said that you were off to a game. So
yeah, I did. I coach the girls soccer team down at Kennebunk High School. Have a lot of fun with the girls. That's something I really enjoy is the game of soccer and coaching soccer. So that's what keeps me sane, keeps me from going bonkers.
that's cool.
Yeah.
Well, I think you answered all my questions. Is there anything else you want to answer for the audience?
No, I think it's really important, and I'm really happy that you have this public access show. It's really good stuff, and I'm really thankful and grateful that you reached out and invited me to talk about these things, and hopefully someone out there learned something about seizures and epilepsy, and if they are having a problem, they can get the care that they need, because we have lots of good medicines to help out, and I think this is great. And this is really neat. So thank you so much for having me. I really appreciate it.
Thank you so much for taking the busy time out of your schedule to come to the studio and meet me for the first time. Thank you so much for joining us. Well, that's the end of the Awesome Ash Show. I hope that you guys all got some info on people that have seizures, or if you need help, call a doctor and they will help you in some way or another. Thank you. Bye.
Ashley asked me if I'd write her a song, so I wrote her a song for her awesome show. Her show is cool and it's lots of fun, so get your popcorn ready, everyone. Who will she interview on her show today? The Jonas Brothers or Nick Lachey? It's the Awesome Ashley Show. The Awesome Ashley Show. The Awesome Ashley Show. La 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 la. Ashley asked me if I'd write her a song, so I wrote her a song for her awesome show.